Welcome to the PMHNP Podcast, the definitive podcast for those passionate about mental health throughout every stage of life. Whether you're an aspiring professional, a seasoned expert, or someone simply keen to understand the intricate world of psychiatric care, you're in the right place. I'm Dr. John Rossi, a certified PMHNP, nurse educator, and lead content creator and instructor at Clarity Education Systems and www.pmhnptesting.com. All right, so in this episode, we're going to talk about something that we're seeing a lot in the PMHNP certification exam, as well as just in clinical practice in general. And it's something that you as a provider need to know how to utilize and really implement into your practice for various reasons and psychiatric conditions. So that is motivational interviewing. But we're going to go beyond just MI, which is motivational interviewing, and talk about the Transtheoretical model of change as well. But motivational interviewing holds significant importance for psychiatric mental health nurse practitioners due to its effectiveness in facilitating behavior change and its patient-centered approach. So we're going to discuss several reasons why MI is so crucial in the psychiatric mental health nursing realm. First, we have enhances patient engagement. So MI fosters a collaborative relationship between the practitioner and the patient. This therapeutic alliance is crucial in psychiatric settings where engagement can be challenging due to the nature of the patient's condition. Next, it supports behavior change. So many psychiatric conditions are intertwined with behaviors that exacerbate the condition, such as substance abuse or non-adherence to medication. Motivational interviewing is effective in helping patients explore their ambivalence towards change and in supporting them to make positive behavioral changes. Third, it empowers the patient. So by focusing on the patient's own motivations and their own goals, MI empowers the patient to take control of their health and their own personal decisions. So this empowerment is particularly important in mental health care, where patients may often feel as if they've lost complete control over their lives. Fourth, it improves treatment adherence. So MI has been shown to improve adherence to treatment plans, including medication adherence and participation in psychotherapy. This is vital for the effective management of psychiatric conditions, where non-adherence can lead to relapse or worsening of symptoms. 5, it addresses comorbid conditions. Patients with psychiatric conditions often have comorbidities, right? Or comorbid conditions such as substance abuse disorders, while at the same time being depressed or anxious or having suicidal ideations. So that requires a nuanced approach. MI is effective in addressing these complex interactions and supporting patients in managing multiple conditions at the same time. Number 6 is culturally sensitive. So MI's patient-centered approach respects and incorporates the patient's cultural background and beliefs into the care plan. This sensitivity can improve engagement and the overall outcomes for the patient from those that have, diverse backgrounds. 7 is evidence-based practice. So the efficacy of MI in various settings, including mental health, has been well documented within the literature. Its inclusion in the PMHNP's toolkit is supported by a solid evidence base, aligning with the broader movement towards evidence-based practice in healthcare. And finally, we're looking at the flexibility and broad application. So motivational interviewing can be adapted and applied to a wide range of psychiatric conditions, settings, and patient populations, making it a very versatile tool for the PMHNP. So incorporating MI into practice allows you to build a stronger therapeutic relationship. It encourages a more engaged patient interaction in their own care, and it effectively supports them in making positive changes that can significantly impact their mental health and their overall well-being. All right, so we've discussed why this is important for the practitioner and the patient in general for progression through their disease process. Now let's dive a little bit deeper into the principles of motivational interviewing and why they're foundational to its practice and guide. And this is going to help the nurse practitioner take control of the interactions with the client. These principles are aimed at creating a supportive environment in which change can be facilitated. So number 1, we're going to express empathy. Motivational interviewing relies on the practitioner's ability to express empathy through reflective listening. Understanding the patient's perspective without judgment encourages a more open and honest dialogue. Second, we're developing discrepancy. So the practitioner helps the patient explore the discrepancies between their current behaviors and the values or goals that they aspire to. This is going to highlight the discrepancy and really focuses on the importance of increasing the patient's awareness of the benefits of change and their intrinsic motivation to do so. Third, we're going to roll with resistance. So instead of opposing resistance directly, the practitioner is encouraged to accept and roll with it. Resistance is not confronted, but rather it's explored, understanding that it's a natural part of the change process. This approach reduces patient defensiveness and promotes a more open exploration of the perspective or the new perspective and its solutions. Fourth, we have supporting self-efficiency. So motivational interviewing involves the belief in the individual's ability to change and supports their sense of self-efficiency. The nurse practitioner helps the client build confidence in their ability to achieve change and overcome obstacles. This is going to be vital for sustained change. Fifth, we avoid argumentation. The MI approach is non-confrontational. The nurse practitioner needs to avoid arguing with clients about the need for change, since this can often lead to resistance and reduced motivation. These principles work together to create a therapeutic approach that is client-centered and focused on eliciting change talk and commitment to change from the client themselves. By adhering to these 5 principles, the nurse practitioner can effectively facilitate and support the change in the individual dealing with the wide range of mental health issues and changes in emotion and changes in response to the circumstances. So as you've probably already ascertained, a huge part of motivational interviewing is communication. And understanding that communication skills are central to MI, we have to emphasize the skills of things like open-ended questions, affirming, reflective listening, and summarizing. And we often refer to OARS as a way to remember, the OARS, or open-ended questions, affirming, reflective listening, and summarizing. This is supportive in the process of evoking intrinsic motivations for change within the patient. Each of these skills serves as a unique purpose in fostering a therapeutic environment conductive of change, despite the common presence of ambivalence or resistance within the patient. So let's dive a little bit deeper into each one of these skills within the role of motivational interviewing. So we just talked about the principles. Now let's discuss each one of these OARS skills. So open-ended questions. These encourage a deeper exploration of the client's thoughts, feelings, and behaviors without leading them to a specific answer. Open-ended questions are pivotal. They help discover more about the client's perspective and their motivations for change or lack of motivation for change. They facilitate a dialogue where the clients can articulate their desires, their fears, and ambivalence about the change, therefore providing valuable insight that can guide the therapeutic process. So let's look at an example of an open-ended question. So this example could be a clinician might ask a patient struggling with substance abuse or misuse, "What brought you here today?" instead of, "Are you looking to quit smoking?" So this open-ended question encourages the patient to show and share more about their motivations, their concerns, their goals, offering a broader understanding of their situation without imposing a practitioner's agenda and really kind of directing them or leading it to a very closed-ended question of yes or no. Next, we have affirming. So affirmations acknowledge the strengths, efforts, and progress of clients, no matter how small. So this positive reinforcement can bolster self-esteem and motivate clients by recognizing their capabilities to change. Affirmations also serve to strengthen the therapeutic alliance, making clients feel seen and valued and supported in their journey towards change. So let's look at an example of affirming. So after a patient shares a small success in their journey towards reducing alcohol intake, you might respond, "It's impressive how you managed to stay mindful of your drinking habits over the weekend. That shows a lot of self-awareness and control." So here, the purpose of this affirmation acknowledges the patient's efforts and success, however small, while reinforcing their capability to change and boost their confidence. Next is reflective listening. So this skill involves actively listening to the client and then reflecting back their thoughts and their feelings. This can validate the client's experience, promoting deeper exploration of their feelings and aid in the clarification of their motivations for change. Reflective listening helps clients hear their own concerns and the patient's ambivalences. They're going to be articulated in a way which can be incredibly powerful in moving them towards change. Let's talk about an example for reflective listening. So a patient expresses, "I feel like every time I try to quit, I just end up smoking more." The clinician reflects, "It sounds like you're feeling trapped in a cycle that's hard to break." So this reflective listening validates the patient's feelings and their personal experiences, encouraging them to explore these feelings further. It helps the patients feel understood and supported, and this client then has a deeper therapeutic relationship with the provider. And finally, we have summarizing. By summarizing the discussion, the practitioner helps the client consolidate their thoughts and their feelings, highlight both their ambivalences and their motivations for change, and then preparing them to move forward. Summaries can reinforce what has been discussed, ensuring both the client and the practitioner understand each other clearly and can spotlight the progress made during the conversation, however incremental it might have been. So an example of summarizing would be discussing the patient's feelings about their recent relapse and their ambivalence towards treatment. So you, the clinician, might say, "So on one hand, you're frustrated with the setback and worried about what it means for your recovery. On the other hand, you're here because you haven't given up and you still see a reason to fight for change. Did I get that right?" So the purpose of this is to summarize and to capture the essence of what the patient has shared, clarifying their ambivalence and readiness to change. It reassures the patient that their concerns are heard and understood, and it sets the stage for moving forward in the therapeutic process. So these 4 skills are instrumental in the evoking process of motivational interviewing, where the aim is to draw the client's own motivations for change rather than imposing external reasons. This approach acknowledges that true, lasting change is most likely to occur when it is self-motivated and self-directed. Mastering these skills enables you, as the provider, to navigate the complex dynamics of change, addressing ambivalence in a constructive way that assigns and aligns with the client's own values and goals. The use of open-ended questions, affirming, reflective listening, and summarizing can transform resistance into a readiness for change, making MI a powerful tool in your hands. So these examples show how MI techniques facilitate that deeper understanding of a patient's experiences and motivations, promote positive reinforcement, and foster an environment where patients can openly explore their ambivalence about the change itself. So through the strategic use of open-ended questions, affirming, reflective listening, and summarizing, you effectively engage patients in the change process, encourage them to articulate and pursue their own reasons for making helpful and healthful changes within their situation, and will ultimately establish that strong and everlasting therapeutic relationship. So we can't talk about the motivational interviewing and how it works in the therapeutic process without discussing the Transtheoretical model of change, or the TMC. So this is going to be a super important area to focus on in your studies, not only for the PMHNP certification exam, but also just in practice in general. So this was developed by Prochaska and DiClemente in the late 1970s and in the early 1980s. And TMC, or the Transtheoretical model of change, this is a framework that describes the stages through which people can go whenever they are considering, initiating, and maintaining behavior change. Now, although motivational interviewing and the Transtheoretical models of change are distinct concepts, they are complementary and often used together in clinical practice in order to facilitate behavior change. In the first stage, or pre-contemplation stage, of the Transtheoretical model of change, individuals do not yet recognize that need for change. Their attitude towards change is characterized by a lack of recognition of their problematic behavior, making them unaware or possibly just uninterested in making the change itself. So this stage it's crucial for understanding because interventions that fail to address the specific mindset of the individual in the pre-contemplation stage are likely to be ineffective. So let's talk about some of the critical markers that are associated with the pre-contemplation stage, and those are going to be reluctance, rebellion, resignation, and then finally rationalizing. And this is how they manifest within the stage and really have implications when trying to institute and utilize a specific intervention. So within the pre-contemplation stage, there's reluctance. So this is when individuals may be unaware of the consequences of their actions or simply comfortable with their current situation. They don't want to make any change. They may avoid discussing or thinking about the need for change due to the lack of information or a previous lack of success in making the change itself. So an intervention strategy for this is education and awareness raising in order to really address the underlying reluctance. So providing information in a non-confrontational way can help increase awareness of the consequences of their behavior and the benefits of change. So next is rebellion. So the characteristic of rebellion is the resistance is more about asserting independence. The individual may resist change as a way to control aspects of their life or to just reject authority, you being the authority in this relationship. So an intervention strategy for rebellion, it's important to adopt a collaborative rather than authoritative stance, offering choices and control over the process. This is going to help reduce resistance and engage the individual in considering change. All right, next, third is going to be resignation. So individuals feel overwhelmed by the idea of change, often due to past failures. They may feel that change is impossible and that they are incapable of affecting their situation. So an intervention for this would be building hope and self-efficacy, highlighting small successes and reframing past attempts at change as learning experiences. And this is going to help the individual feel more capable of making change. Finally, we have rationalizing. So rationalization serves as a defense mechanism, right? To protect the self from perceived threats of change. Individuals may offer plausible but surface-level reasons for why change is not necessary or even possible. So an intervention for rationalization would be motivational interviewing techniques, such as reflective listening and the exploration of ambivalence. These can be effective, encouraging the individual to consider and articulate their own reasons for and against change in order to help them move beyond superficial rationalizations. So in general, when dealing with individuals in the pre-contemplation stage, the overreaching goal is to help them move towards recognizing the possibility and benefits of change. This involves gentle persuasion and encouragement rather than direct confrontation or attempts to induce this change directly. The aim is to foster an environment where the individual begins to consider change as both desirable and possible, gradually moving them towards the contemplation stage where they start to think seriously about change. Okay, so that was pre-contemplation. So now let's go right into the next one, which is the contemplation stage of the TMC. So individuals are caught in a state of this ambivalence and then, gosh, can I make the change? So this stage is characterized by simultaneous recognition of the reasons for change and the perceived benefits of maintaining the status quo. So let's take a deeper look at this contemplation stage. Attitude. This is the attitude of yes, no. The contemplation stage is marked by conflicting attitudes towards change. On one hand, individuals recognize that change could bring about positive outcomes or alleviate their problems. On the other hand, they may feel unsure about their ability to change. They fear loss of coping mechanisms or simply enjoy aspects of their current behavior despite its negative consequences. So they have a core thought: I don't need to change. Despite acknowledging potential benefits of the change, the individual in this stage often maintain core beliefs that change may not be necessary. This belief can stem from various sources. This can include fear of failure, comfort and familiarity, or just underestimating the negative impacts of their current behavior. All right, so some of the critical markers within the contemplation stage are going to be first, ambivalence. So ambivalence is that hallmark of contemplation stage. So we talk about ambivalence a lot during this podcast because it goes hand in hand. It's core to the concepts of motivational interviewing and the Transtheoretical change model. So what is ambivalence? So it manifests as opening internal debate about whether the benefits of change outweigh the cost. This state can lead to significant emotional stress, as individuals are going to start to feel torn between two paths, each with their own set of implications and their own set of outcomes. So people in the contemplation stage are aware of the positives of changing, but are also actually aware of drawbacks. This can lead to prolonged periods of inaction, where the desire to change is neutralized by fears and perceived barriers. The stress of feeling stuck can exasperate the situation, making it harder to make a decisive move towards change. So how do we navigate through this contemplation stage? It's a difficult stage. For individuals in the stage, interventions that gently challenge their ambivalence can be helpful. Techniques such as motivational interviewing can be particularly effective. So why? They validate the individual's feelings of ambivalence, acknowledging that it's a normal and understandable part of the change process. Helping individuals articulate their reasons for wanting to change, enhancing their awareness of the negative impacts of their current behavior and the potential benefits of change are super important. Support individuals in envisioning a future where they've made the change already, increasing their motivation by connecting the change to their values, goals, and overall well-being. What's really important and key is to encourage small, non-threatening steps towards change, allowing individuals to experiment with change without committing to a full transformation immediately and all at once. So by addressing ambivalence directly and compassionately, you, as the nurse practitioner, help support individuals in this contemplation stage to gradually shift towards preparation and action, moving closer to achieving that change goal that you and the patient have established. Okay, so now we shift from the contemplation stage to the preparation stage of the Transtheoretical model of change. And this is marked by an individual's acknowledgement of the need for change and the beginning steps towards making that change a reality. While there's a shift towards a more positive attitude about the change, characterized by yes, but, statements, this stage also involves a degree of procrastination or hesitancy to fully commit to the change process. So let's take a closer look at this stage and the strategies that support it. So characteristics of the preparation stage. This includes acknowledgement of need. Individuals recognize that change is important and consider themselves capable of making this change. This represents a significant shift from the contemplation stage where ambivalence prevails. The initial steps of the preparation stage are often dealt with a history of small, perhaps unsuccessful attempts at change. These initial efforts, they're going to be crucial as they reflect the individual's willingness to experiment with that change. And then they're going to start seeking support. So individuals may start to seek out information, resources, and support systems that can aid in the change process. This might involve researching different methods for change, talking to others who have already successfully made the change, or seeking professional help, like talking to you more about it. So identifying barriers and resources are also a part of the preparation stage. There's a conscious effort to identify what obstacles might impede progress and what resources are available to overcome these barriers. This might involve making lists or setting preliminary goals or developing a basic plan of action. So we have to identify some of the key problems or critical markers that are involved in the preparation stage. First is going to be procrastination. So even as individuals recognize the need for change and begin to make those initial first steps, they often find reasons to delay more significant actions. This procrastination can be due to fear of failure, uncertainty about how to proceed, or just a lack of urgency. So intervention strategy for this manifestation of procrastination, we support the individual in the preparation stage. It's an important focus in order to build momentum and reduce procrastination. So we start by setting small, achievable goals. We help them break down the change into smaller, more manageable steps. Achieving these smaller goals can build confidence and momentum. Then we enhance self-efficacy. We reinforce their belief in their ability to make the change. We highlight past successes, no matter how small, and remind them of their strengths. Then we address the barriers. We work together to develop strategies for overcoming identified obstacles. So this might involve role-playing to practice responses to challenges or brainstorming alternative approaches to the barrier that exists. Then we create a supportive environment. We encourage the formation of strengthening of support networks, knowing they're not alone in this journey. This is going to help provide them motivation and accountability. And this really it shouldn't just include you. We have to establish a supportive environment outside the therapeutic relationship as well. And then we set a date. We encourage setting a specific start date for that change. This is going to help shift the mindset from planning to action. So in the preparation stage, the focus shifts from contemplation to action, encouraging clients to take small, concrete steps towards change to help them overcome procrastination and build the confidence needed to move into the action stage of change. So we acknowledge their concerns and provide practical support. You help the individual navigate critical phases more effectively, right? This is going to give them the skills, the tools, the understanding that they need to set the stage for a successful and lasting change and to really propel them into the next stage, which is action. So the action stage is a pivotal phase in this transtheoretical model of change, signifying the period where individuals actively implement change in their behaviors, in their lifestyles, or in their overall attitude. It's a time of significant effort, commitment, and visible transformation, reflecting a strong affirmative stance towards change itself. But this stage also presents its challenges and its complexities and can be a frustrating stage in this process. So key characteristics within the action stage. This is going to be a visible change. So this stage is marked by tangible steps taken towards the behavior change itself, making the efforts and outcomes noticeable to both you and the individual and others that are involved in this process. We see a moment of increased effort. So individuals in the action stage invest substantial time, energy, and resources into making these changes, often requiring considerable rearrangement of their daily routines, their lives, and their priorities. Then we see an emotional and cognitive shift. So as part of the change process, there's often this reevaluation of self-perception, of self-beliefs, of self-emotional responses. And this is going to lead to that reshaped identity that aligns with the new behavior within the action stage. So what do we find within the action stage? What are some of the challenges and considerations that you have to consider? First, there's going to be setbacks. There's going to be reassumptions of old behaviors. It's common. It is very much a part of this key stage where the individual starts to encounter these obstacles or temporarily revert back to previous behaviors, such as instances that can lead to feelings of demoralization and self-doubt. So how do we manage it? How do we manage these slips as part of the process? First, recognizing that setbacks are not failures, but part of the learning and growing process is going to be crucial. These moments provide valuable insights into triggers and challenges, offering opportunities for adjustments and then strengthening of strategies for maintaining the change. We need to offer continuous support, emotional, informational, and sometimes practical support from professionals like you, their peers, or loved ones. These can all play critical roles in navigating the stage successfully. Encouragement and understanding from others helps to sustain motivation and resilience. Okay, so now that we've looked at the challenges and considerations within the action stage, we start to establish strategies for success. We prepare for potential setbacks and planning specific strategies to deal with them in order to enhance resilience. So this is going to include things like identifying triggers, implementing healthier coping mechanisms, and having a support system in place. By doing this, we reinforce progress. We celebrate milestones and we recognize the effort and progress made, no matter how small, in order to help boost self-esteem and motivation. Then we do some reflection and adjustment. We regularly reflect on the change process and allow for adjustment in strategies as needed. This is going to help ensure that they remain effective and aligned with the individual's goals and circumstances. So understanding the complexities of the action stage, including its challenges and strategies for success, is going to be crucial for anyone undergoing this behavior change. It provides a roadmap for navigating the critical phase, ensuring that individuals are better equipped to preserve, learn from setbacks, and then continue progressing towards their goals. Now, when we go beyond the action stage, we start to develop the maintenance stage of the TMC. And this represents a period where individuals have successfully sustained the changes they've set out to make. And then typically for about 6 months or more, we're within this maintenance stage of the TMC. So the primary focus during the maintenance stage is on consolidating the gains achieved during the action stage and preventing relapse into old behaviors. This is going to be effective by understanding the dynamics of the stage and the crucialness for support during the long-term change. So what are the characteristics of the maintenance stage? First is going to be achievement of goals. Individuals have implemented the changes they intended to make and are now working to integrate these changes into their daily lives permanently. So sustained change is the key concept. The changes made during the action stage are maintained over time. This often requires ongoing effort and vigilance to prevent relapse. Having successfully made and maintained changes is going to boost the individual's confidence and their ability to continue these behaviors and tackle other changes in the future. So some of the critical markers that we see within the maintenance stage are going to be commitment. So a strong commitment to maintaining new behaviors is going to be vital. This commitment is continually tested and by the temptations that they may have to revert back to old behaviors, especially in the face of new stress or negative emotions. So complacency and the onset of negative circumstances can undermine the commitment to maintaining change. Without active engagement in maintenance strategies, individuals start to gradually slip back into old patterns. So as the provider, it's really important that you have strategies during the maintenance plan or phase in order to support the patient. You want to work with the client to identify potential triggers for relapse and then develop strategies for dealing with them. This might include stress management techniques, avoidance strategies for high-risk situations, or plans for getting back on track after the slip. And then we offer continued support, ongoing support from you, the professional, or support groups that they're a part of, or peers that they can encourage and hold that patient accountable for their maintenance and their continued success within this change. This is going to all help maintain motivation. Then we have coping strategies, right? We need to teach coping strategies for dealing with setbacks without reverting back to old behaviors. And then this helps us understand that occasional slips do not equate to failure, but are part of the learning process. So coping strategies are going to deal with a lot of cognitive behavioral skills and techniques, helping them ground themselves in the situation, cognitive restructuring, really taking a moment to figure out how they deal with the stress and then correcting it and replacing it with healthy coping mechanisms and strategies. So in the maintenance stage, the emphasis shifts from achieving change to living in the change. The challenges in this stage are different from those that we saw in earlier stages, focusing on integrating the change into one's lifestyle and identifying and preventing relapse. Encouraging clients to maintain vigilance, to continue using strategies that help them achieve the change, and then to view maintenance as an active process rather than a passive one, are all going to help ensure that the changes become a permanent part of their lives. Recognizing and celebrating the effort that is required during the maintenance stage is going to help bolster their commitment, and it's going to help them maintain motivation in order to continue that change. All right, next we're going to move into the final stage, which isn't necessarily a part of a lot of trans-theoretical models of change. It's sometimes seen as a stage, sometimes not seen as a stage, but I wanted to include it because I think it's a pretty important part of the change process, and that's going to be the termination stage. So let's focus on what happens during this portion of the change situation. So this termination stage, as identified and defined by the TMC, represents the final phase of the behavior change process. At this point, individuals have successfully maintained their new behavior or their lifestyle change for a significant period of time and have no longer are experiencing this temptation to revert back to the old behavior. So they possess a high level of self-efficacy and self-confidence in their ability to continue their new behavior without relapse. This stage is characterized by a profound transformation where the new behavior becomes an integral part of the individual's identity. So key characteristics of the termination stage are going to include complete confidence. Individuals have a full confidence in their new behavior and do not feel threatened by situations that might trigger or relapse that past situation or behavior that they had originally reverted back to. And then we have integrated behavior. The new behavior is fully integrated into the individual's lifestyle and their identity. It's no longer seen as something they need to work on. It's just a part of who they are. Then there's absence of temptation. So unlike earlier stages where temptation might lead to relapse, in the termination stage, individuals no longer experience the desire to return to their old habits. So there are some specific challenges and considerations during the termination stage. While reaching the termination stage is an accomplishment, it's essential to recognize that the journey of personal growth and adaptation continues. Individuals might face new challenges or life changes that test their resilience and commitment to the new behavior. The key is to apply the skills and strategies they've learned throughout the behavior change process to these new situations that may and probably will show up. So we have to help them with continuous self-reflection, regularly reflecting on the journey and the benefits of the new behavior in order to reinforce the importance of maintaining this change. Next, they're setting new goals. So with the primary behavior change goal achieved, setting new personal or professional goals can provide continued motivation and direction. Mentorship and support. Individuals who have reached this stage can offer invaluable support and guidance to others who are in the earlier stages in their behavior change journey. So acting as a mentor can reinforce their own commitment to the new behavior while providing a sense of fulfillment. So you're going to be their mentor and offer them support and then helping them to then step into that role as well. It's just a more advanced situation and part of the change process. So reaching the termination stage, this is obviously a significant achievement. It's a marked period where the individual has not only achieved, but has sustained a desired change, transforming their actions, their mindset, and then ultimately their identity. So this stage highlights the important goal of the Transtheoretical model of change, which is to facilitate lasting change that promotes personal growth and well-being. It's a testament to the individual's perseverance, resilience, and capacity for self-directed change, serving as a foundation for their continued growth and their development. So the outlined approach that we just went over provides a structured way to assess and enhance readiness for change in the client. It's going to utilize principles of motivational interviewing, or MI, and the Transtheoretical model of change by focusing on willingness, ability, and readiness to take action. So this method helps your patient or your client move from ambivalence to a state where their change becomes possible. All right, so at this point in the discussion, I want to take another close look at the breakdown of the process in general while offering some examples how you'll use it in the clinical practice area as well as preparing for your certification exam. So, step one, we're going to assess the importance of change. Ask the client or the patient to rate the importance of making the desired change on a scale of 0 to 100. This quantitative measure serves as a starting point for deeper exploration. This step initiates self-reflection regarding the client's current position on the change continuum, facilitating a personalized understanding of their motivational level. Step 2, reflect on the answers provided. Engage the client in a decision about their chosen rating, focusing first on the rationale behind their score, especially if it's lower, right? If it's a low score, we really got to focus on that. This conversation can help reveal underlying factors influencing their readiness for change. This reflective dialogue aims to uncover personal insights, reservations, and potential misunderstandings that may affect the patient's perceived importance of the change. Step 3 is we elicit change talk. Depending on the client's score and reflection, we facilitate discussions around values, hopes, goals, and the discrepancy between current behaviors and desired outcomes. So value exploration. This is questions about what is important in the patient's life that can help identify discrepancies between their current state and their core values, potentially motivating the change. Hopes and goals. Discussing the patient's aspirations provides context for the change, helping them visualize how the desired change aligns with their future self. And then we elicit discrepancy, directly comparing the client's current behaviors with their values and goals. This is going to help highlight the need for change and then making the abstract concept of change a more concrete and actionable situation. So this phase aims to shift the client's perspective, right? And sometimes your perspective as well, from seeing change as optional or daunting to viewing it as an essential step towards living a life that aligns with their values and their goals or aspirations. So utilizing these steps in a therapeutic setting can effectively transition clients from a state of ambivalence or resistance, right, that we just previously talked about, to one where they recognize the value of change itself. So engaging in a process that emphasizes self-discovery and personal relevance. This is going to help them more likely to move towards actionable steps. So for the clinician, it's crucial for this approach and this process to be conversational with empathy, avoiding judgment. The goal is to guide clients in exploring their own motivations and barriers, not to persuade them with external arguments, right? And then for the client or the patient, this process provides an opportunity to deeply consider their reasons for the change, enhancing their motivation from within. It transforms the concept of change from the daunting challenge imposed by external pressures to personal choice, aligned with their deeper value, their goal, and their aspirations. So the comprehensive approach that we've been discussing for the past 40 minutes or so is really just a simple process for assessing readiness for change and then increasing self-efficacy and motivation by utilizing the principles of MI and TMC. So these approaches recognize the complexity of behavior change, and then we emphasize the importance of interventions that lead to a positive and lasting change within the client's state of readiness. Okay, we've really focused on a lot of information here. This should have been a pretty in-depth review and maybe new introduction to motivational interviewing and that model of change. So let's now apply it to a specific scenario within clinical practice. So we're going to utilize motivational interviewing techniques during a session with the patient, Alex. This is a patient struggling with bulimia nervosa. So you as the PMHNP are going to aim to explore Alex's ambivalence about changing their eating behaviors in order to enhance their motivation for recovery. So I will play the part of both the PMHNP and Alex the patient. So here we go. Thank you for coming in today, Alex. How are you feeling about being here? I'm not sure. Part of me knows I need help, but another part feels like I can manage this on my own. It sounds like you're torn, right, Alex? On a scale of 0 to 100, where would you place your current desire to change your eating habits? I don't know, maybe a 60? I hate how much bulimia controls my life, but I'm scared of gaining weight if I stop. That's a significant number, 60. What makes 60 for you instead of something lower? Well, I guess because my health has started to suffer, and I'm tired of all the secrecy. It sounds like your health and the burden of secrecy are important to you. How do these concerns align with your values or hopes about the future, what your future looks like? I've always valued being healthy and honest. Bulimia feels like it's taking both of those away from me. It's powerful that you see how bulimia is affecting key values in your life. If you were to make a change, what would you hope to achieve? I want to be free from this cycle, from this, always going back to what I've been previously doing and this, these poor steps that I'm taking. I dream of a day when food isn't my enemy. Those are meaningful goals, Alex. Tell me about the time in the past when you overcame a difficult challenge. What strengths did you draw on? Well, I graduated from college. That was really hard, and despite my anxiety disorder, I was still able to do it. I guess I'm resilient and good at seeking support when I need it. That's something I've never been afraid to ask. Wow, thank you for sharing that experience and that example. That resilience and the ability to seek support are significant strengths, Alex. How might they help you in understanding your eating disorder? Maybe I could be more open about my struggles and seeking help instead of hiding it. Considering the good and the not so aspects of changing, how does continuing your current eating behaviors fit with your future or your envision for yourself? Well, it doesn't. I want to be healthier and more honest, but I'm afraid of failing. Alex, it's normal to feel scared of failure. What would it mean for you to take a small step towards your health and honesty, knowing that resilience is on your side? Well, it might mean I'm finally ready to fight for my life and for what I want. I think I'd like to try something like that. Alex, what I hear you saying is that you value health and honesty, and you're beginning to see how taking steps towards change, despite the fear of failure, could align with those values. You've shown resilience in the past, Alex, and that strength can support you through this process too. Yes, that's right. It's going to be hard. I know it will, but maybe I can do it. You've already taken the first step by being here today. Let's explore what support you'll need and outline some small and achievable steps together. So this dialogue illustrated how motivational interviewing techniques, things like open-ended questions, affirmations, reflective listening, and then summarizing, can be helped and employed by the PMHNP to engage this patient and future patients with bulimia nervosa or other disorders in a discussion about change. By focusing on Alex's values, his hopes, and his strengths, you as the PMHNP help the patient move from ambivalence towards readiness. And it helps them understand that this is something that can happen right now. We can get started with small steps and small changes and start working towards that goal that they have identified during your therapeutic session with them. So motivational interviewing is client-centered. It's the directive method for enhancing intrinsic motivation by change and by exploring and resolving ambivalence. It is characterized by its focus on engaging with clients in a collaborative conversation that supports their autonomy and encourages them to speak out about their reasons for change. So let's do a quick overview, a quick reflection as we end this discussion today to make sure that you've really grasped these ideas and these concepts so that now you'll never miss a question about motivational interviewing and it'll be something that you can utilize daily in your practice. So recall that it was developed in the early 1980s by clinical psychologists William R. Miller and Stephen Rolnick. MI was initially conceived as a way to treat problem drinkers. Its effectiveness, however, has since been demonstrated across a wide range of behavioral changes, including substance abuse, smoking cessation, weight loss, and managing chronic health conditions. The core of MI is built around the concept of ambivalence towards change and utilizes strategic communication techniques to foster the natural process of change within the individual. This approach diverges from traditional directive or confrontational methods, positioning the therapist or the PMHNP or any healthcare provider not as an authority, but as a facilitator of change. The methodology is underpinned by 4 fundamental processes: engaging, focusing, evoking, and planning. These processes guide the interaction from establishing a trusting relationship to developing and consolidating the client's motivation, and then ultimately formulating a commitment to change. Central to MI are the principles of expressing empathy, developing discrepancy, rolling with resistance, and supporting self-efficacy. These principles help the patient articulate their reasons for change, increase their confidence in their ability to change, and enhance their readiness to take action. The techniques employed by motivational interviewing, summarized by the acronym OARS, include open-ended questions, affirmations, reflective listening, and summarizing. Together, these techniques and principles create a supportive and non-judgmental environment in which a client or a patient can explore their feelings and concerns about change, therefore increasing their motivation and commitment to act. Now, a significant aspect of MI's effectiveness is its adaptability across different populations and settings, making it a valuable tool for a broad spectrum of healthcare providers, including psychologists, psychiatrists, nurse practitioners, nurses, and social workers. Research has consistently supported MI's efficacy in facilitating behavior changes, particularly in the fields of addiction and mental health, where it's been integrated into treatment protocols worldwide. Motivational interviewing also acknowledges the stages of change outlined in the Transtheoretical model of change, or TMC, recognizing that an individual's readiness to change may vary. MI techniques are thus tailored to meet the client at their current stage of change, be it pre-contemplation, contemplation, preparation, action, or maintenance. This is used to assist them in moving through these stages at their own pace. In summary, motivational interviewing is a compassionate and empowering approach to behavior change. It respects the client's autonomy, leverages their strengths, and acknowledges the complexity of the change process. Since its inception, MI has grown not only in popularity, but also in its application, proving it to be an effective tool in helping individuals overcome the ambivalence that so often impedes change, thereby facilitating meaningful and lasting transformation. Motivational interviewing really helps you as the PMHNP establish a therapeutic relationship that is founded and grounded in trust and willingness to create an environment where change is not only possible, it's probable. And motivational interviewing, utilizing these processes and these steps, is what's going to help establish that relationship and really propel your patient forward, and you as well, as you develop these skills so that it doesn't seem scripted or it doesn't seem like you're just using this thing that you learned in school, but it's actually conversational. It's actually something that you can fall back on and utilize in daily practice to help as many patients as you possibly can. All right, I appreciate your time today and listening to this podcast. It's always such a great experience for me to reflect back on these clinical practice skills that I've learned and that I'm trying really hard to use on a daily basis to help you not only prepare for your certification exam, but to go forward and just really implement these things in your practice so that we can help as many people as possible heal and become agents for self-change, that they can go out and do everything that they dream about doing because we have these great therapeutic exercises and evidence-based and grounded theories to go out and help facilitate this change for good into the future. Thank you for listening. I look forward to being with you in future podcasts and seeing you in our live in-person PMHNP certification reviews or online for the on-demand review where you have access to all of the material and study for 24 hours a day, 7 days a week to help fit your busy schedules. Congratulations on everything that you're doing. Keep up all of the effort. Keep moving forward and doing what you need to do in order to better yourself and to better your practice for the mental health community. Again, I'm Dr. John Rossi for Clarity Education Systems and www.pmhnptesting.com. We'll see you in the next podcast. Bye-bye.